The history of heart transplantation is a tale of medical innovation, bravery, and immense dedication that continues to shape the lives of many around the world. The first successful human heart transplant represents a milestone in modern medicine and has had a profound impact on the treatment of heart disease. On December 3rd, 1967, a groundbreaking operation took place at Groote Schuur Hospital in Cape Town, South Africa. Dr. Christian Barnard, a South African cardiac surgeon, led a team that performed the world's first successful human-to-human heart transplant. The patient, 53-year-old Louis Washkansky, received the heart of Denise Darval, a 25-year-old woman who had been fatally injured in a car accident. This monumental event followed years of extensive animal research and a handful of previous human attempts that had not resulted in sustained survival post-transplant. Prior to Barnard's success, the longest a patient had survived after a heart transplant was a mere 18 days, due to the body's rejection of the new organ and a lack of effective immunosuppressive drugs. Barnard's operation lasted approximately 6 hours, and initially it was a success. Washkansky's new heart functioned normally. However, the patient died 18 days later from pneumonia, which occurred partly because the drugs that suppressed his immune system made him highly susceptible to infections. Despite the early complications and tragedies associated with the era's heart transplants, Dr. Barnard's work brought hope to thousands suffering from end-stage heart disease. His bold endeavor ushered in a new age of cardiac surgery and highlighted the urgent need for advancements in immunosuppression. The legacy of the first heart transplant is felt through its contribution to the understanding of organ rejection and the development of better immunosuppressive drugs. By the 1980s, the introduction of cyclosporin, an immunosuppressive medication, greatly improved the survival rates of transplant patients. According to the Registry of the International Society for Heart and Lung Transplantation, ISLT, the survival rate for heart transplant patients has increased considerably, with about 85% of patients surviving 1 year, 75% surviving 5 years, and over 50% living at least 10 years. As of today, heart transplantation has become a standard treatment for patients with end-stage heart failure. The number of heart transplants performed annually worldwide exceeds 5,000. Despite this progress, there remains a significant challenge: the dearth of available donor hearts. Only a fraction of patients who could benefit from a heart transplant ever receive one, a reality that underscores the need for continuous advancements in both organ donation systems and alternative treatments, such as ventricular assist devices and biotechnology-driven solutions like bio-artificial hearts. The first successful heart transplant operation marked not only a technical and ethical paradigm shift, but also deeply affected public perceptions of medicine, the sanctity of life, and the definition of death, as it sparked global discussions on brain death and organ donation ethics. In conclusion, the first successful heart transplant remains a landmark in medical history, representing a moment when the boundaries of life, death, and technology were pushed further than ever before. The operation's impact transcends the technical aspects of surgery to touch on legal, ethical, and socio-cultural implications, significantly shaping the evolution of both the medical field and society's approach to human health and mortality.